This is Candid Conversations with Dr. Mayfield, a podcast that resources families and friends with tools to have important conversations about mental and emotional health. This show is sponsored by Mayfield Counseling Centers, helping you find clarity, hope, and purpose. Here's your host, Trever Shirin.
Thank you for joining us on Candid Conversations. I'm Trever Shirin, joined by Dr. Mayfield and lacking the presence of my brain this morning.
Hey, it's okay. We have those days, or weeks,
which is
or months,
a half decent tie-in to what we're going to talk about
right.
today of the practice of presence, which we're going to have to model today in this episode. Dr. Mayfield, would you share with us kind of just a working definition of what we're talking about by practicing presence?
I love this topic because I think in our world, we get so busy that we breeze through things, we overlook things. I think, I guess let's do a working definition before I get into it. I think just a working definition is being aware of yourself, of being aware not only of your thoughts, but your emotions, even your physiology. Like, when was the last time you sat down and paid attention to how your body felt? That twinge in your lower left back, or the fact that every time you take a deep breath, you feel like you're going to cough, or those kinds of things.
Yeah.
It's that slowing down in the stillness of wherever that might be, and just being aware and being present with yourself. I don't think we do that very often.
Something I'm thinking about. I had like some of you know, I am a fledgling, barely therapist in my practicum at
You're
school.
almost done with the semester. So
I'm almost done with a semester.
You're almost like a half therapist.
Yeah, barely.
Yeah.
But I had this one client with some pretty significant panic and anxiety. And my thought was, maybe it would be beneficial for this individual to scan their body and kind of pay attention to what's going on. But because of the anxiety and panic that this person was feeling, it kind of spiraled and became this really uncomfortable and scary thing for them. And I want to, in the midst of this conversation, just because that was pretty, I was really nervous about that, because I was like, how did I mess that up? I did so,
Right.
But
Crap.
So is there a time when that can be dangerous, or is there anything that we should think about before we start being present, or is it something that we should just dive into?
I think it needs to be layered depending on your story. So if you've had severe trauma, there's no way I'm going to ask you to be present with your body at the moment. Why? Because your body's not safe. If you, especially if it's been an assault on your body, right? Whether it be some kind of physical or sexual assault or whatever. So being present with your body in those moments is actually detrimental and scary, because it's so uncertain. And the uncertainty then lays into or plays into panic, deeper anxiety, and that kind of stuff. So with a client like that, what I would probably do is go, let's just be mindful of the room around us. Kind of the 5, 4, 3, 2, 1 thing. Name 5 things that you hear, 5 things that you see, or 4 things that you see, 3 things that you can touch. And those. So it's not asking them to be present with their body, but it's asking them to be grounded with the room around them. And so as you start teaching them groundedness or mindfulness type things, you can begin to introduce, okay, sit here for a minute, close your eyes if you're comfortable. I always invite people to close their eyes, because some people that's scary. Can you feel the top of your head? The tippy top of your head. And as I'm talking about it, I'm like, okay, I'm focusing on the top of my head. I can feel the top of my head. You introduce those
it's like being aware of your tongue.
Right. Yeah. Now we're going to be talking. Sounds like we're that. But then you introduce those things instead of the whole full body scan, which can be really scary. You go, okay, how about your ears? Can you feel your ears? And that becomes more aware of themselves. And that's really good for teenagers. It's really good for, I think, especially parents too, just becoming aware of themselves when they're in relationship with their teenagers and having a rough time, or their kids or a coworker or whatever.
So if we're someone with some of that in their past, or a trepidation of being present with their body or even their emotions or thoughts, having something to focus in on first, like the top of your head, or probably not your tongue because that's just annoying, can be a really beneficial first step.
Right. And there's such a beautiful array of mindfulness techniques and tools. I mean, you can do some guided imagery, of having them. My favorite one is the river with the maple leaf, and having them put all their negative cognitions onto that maple leaf and watching it float down the river. And it's based on the individuals. But I think if we want to look at a broader sense of things, this idea of being present, and it's practicing the presence. I think it's just this idea of, do I know who I am? Am I okay with who I am? And do my thoughts and my emotions scare me, or am I able to to embrace them, whether I like them or not? I ask my clients this all the time, and for those of you that are listening are probably going to be like, "Huh?" But what does it look like to become old friends with your emotions? And that's because there's no good or bad emotions. There are emotions, and some emotions are easy to sit with, and others are hard to sit with. And so, how do we, if we're practicing the presence, how do we embrace this idea of anxiety? And I think that word is overused quite a bit. And I think depression's overused quite a bit. So maybe how do we sit with worry and not let it ruin us, but go, why am I worried? How does worry feel? If you want to think of what is the shape of worry? What is the color of worry? What are the nuances of worry? Well, now worry doesn't scare me. Yeah. It's that emotion that comes in because of a thought. What is that thought that usually comes with, and so you start figuring those things out in a more systematic way. Yeah. But if you can embrace worry, then how much more is peace going to impact your life? Because you now know what worry really looks like, feels like, tastes like, smells like, however all the senses. Yeah. And now peace comes in, and you're like, man, people have, if you look at poets and you look at authors, they use, peace comes over like a wave, or, this presence or whatever, and if you've not experienced the adverse, just a thought.
Yeah. Well, and I think, I don't know about you, but I've found also that once I start feeling those things, it's helpful for me to be able to ask myself, what would I say to a friend if they were telling me the things I'm thinking?
Sure.
And that, degree of separation, I think a lot of us have really good encouragement or statements of heartening to give to others. And we kind of need to step to the side to do that for ourselves.
Absolutely.
And it can be really helpful.
Well, and Dr. Caroline Leaf, who is, we love her at Mayfield Counseling Centers, and we use her stuff a lot. She's been a part of our conferences in the past year and coming back this year. And she talks about this idea based on science that we have the opportunity every 10 seconds to come into awareness of ourselves, right? And readjust. And then she said that, I'm like, yeah, right. Like every 10 seconds, and as I've really slowed down over the last year or 6 months since we've heard that, I'm like, man, there's definitely truth to this, because, I'm bruised, I'm pushing through the day, and at the end of the day, I've got just this heavy weight on my chest. Like, where'd that come from? Well, if I was paying attention to my thoughts and my feelings and my physiology, at least half that amount of time. So maybe every 30 seconds, right? Be like, oh, why am I thinking this way or feeling this way? And it goes back to this idea of holding our thoughts captive, thinking on positive things, recognizing when those negative things come in, and going, okay, those came in. I didn't maybe have any control over what came in, but I have control over what I do with those things. Yeah. And I don't think many Americans or many people in this world really grasp the idea that things aren't done to them. They are a part of things that are being done. And then, we might have, if I slap you right now, right? You're going to have a thought and emotion, and it's going to hurt. And then in that moment, if you are aware of yourself and then sat with yourself in the presence, you're like, okay, what do I do with that? Why did he do that? Did I do anything to hurt him? And you're working through all these things, and you might slap me back, but that was your choice.
Right.
Or you might say, man, he's just having a really bad day. And whatever, right?
Which is my choice.
It's your
well.
choice.
Yeah, I've got a lot of choice after that moment.
And I think we abdicate that.
Yeah.
To chance or to society, we blame a lot. I don't know how much, up until say I'm almost 38. Like I've been early part of my life just blaming life on circumstances and people and things, and it's.
Well, and I think so. We've talked a lot about complacency as well, and I think that plays a role here as too. Of sometimes it's far more passive than what we've talked about so far, and it's just going along with the whatever, and you're just part of the flow and moving along, and you wake up, you go to work, you come home, you do this, you have this argument with that person, you feel this way and ignore it or self-medicate with TV or whatever, and we just keep going, and we miss every 10-second opportunity in a day.
Right.
And it is a habit that we need to form in order to do effectively.
It's a neural pathway, right? It's the idea, and this is where I don't want to get too scientific for our listeners, but we have to decide whether or not the brain controls the mind or the mind controls the brain. And I was talking about this yesterday. I was doing a live Facebook with about 30 or 40 other individuals in the country that are in ministry on this. And it's this idea that if we believe that the brain controls the mind, then we're kind of helpless, right? The neural pathways are what control our emotions and our thoughts. But
and you're probably, it might be helpful to to describe the difference between the two, because I think we're starting a step ahead.
So yes, good point.
Normal thought.
So the brain is our physical organ, right? In a lot of ways, the brain is a dumb organ. Neurons that fire together wire together. Meaning, you grab a cup of coffee every morning before you grab your keys. Well, it's that desire to grab coffee before your keys is that neural pathway that you've developed, that you have to have your coffee before you grab your keys before you got the door. So the neurons are firing, and now they're wiring. So now it's a habit. I need my coffee. If I don't have my coffee, something's off.
If you don't have your coffee, you're going to forget your keys.
Keys, right? Exactly. So that's the brain piece. And basically, though, the mind is told. So the mind is the non-physical piece of us. It's our consciousness. It's our emotions. It's the seat of our spirituality. It's all that piece, right? And science has been showing that our mind, and Dr. Dan Siegel talks about this, Dr. Caroline Leaf talks about this, that our mind is what is controlling our brain. And so if that is true, which it is, science shows that through quantum physics and a bunch of different things, it's the fact now that we cannot abdicate the responsibility of our circumstances in our life to just happenstance. We have to take responsibility for our thoughts and our emotions, and just the power of what our thoughts and our emotions do to our physiology.
Yeah.
Cancer trial. If you look at cancer, and I think it was a recent. I don't butcher the date, so I'm not going to even say the date. But a recent study shows that a majority of an oncology unit in the East Coast, their patients had unforgiveness and bitterness. Like at 90 some odd %.
Yeah.
That's not just happenstance. That's choice. That's, allowing our thoughts to take hold and to take seed. And
Well, isn't it Dan Siegel that said everything psychological is physiological? And just saying that our brain, our mental state affects our body.
Right.
And we talked about this several weeks ago about the placebo effect and how mind-bogglingly powerful our brains are when we believe in something.
Well, and that's where I really, and I don't want to step on anybody's toes, but this is candid conversation, so we're going to have a candid conversation here. I think that's why medication works. I really don't believe, to some degree. Now, I don't want to get myself in trouble here, so I think there are points in time and places for medication, and it can be It can be a blip in the radar. I need this to help me kind of get to the certain step. Or for some of us, it might be ongoing, and that's nothing wrong with that. But how much of the act of taking medication is actually benefiting the individual versus the medication or the pill itself?
Well, I might be wrong in this. I'll have to do a little bit more research on it afterwards, but I'm pretty confident that once you start taking something like Zoloft or an antidepressant, about 2 weeks in, there's the false positive, or there's it's almost a placebo effect where you're
feeling better.
You're feeling better, but the medication hasn't actually taken its effect in the way that it's supposed to yet.
Right.
And so you'll start feeling like, oh yeah, this medication is working for me. And some of it is the brain just believing that it's working.
Well, but it's that thought piece. And so if that's the case, look at the power of our thoughts. Look at the power of the ability for us to unlock our genetic makeup, the epigenetic pieces of ourselves based on how we think, and how there's toxicity, in our thoughts, or we can choose the positivity. I mean, I'm going to change a lot of my story to protect an individual that I've saw many, many years ago. But I had this woman come in, probably in her early 30s or 40s, late 30s, early 40s, and she had a lot of nerve issues in her feet, where she, at times her feet would go numb. She couldn't feel her feet, a lot of pain in her feet and that kind of stuff. And yeah, she had accidents in her younger years, breaking a tailbone or, those kinds of things. But she came in because it just was unbearable. And one of her doctors said, you probably should go see a counselor because we can't find anything medically wrong. And so we started working through story and trauma and those kinds of things, and found out that she had some significant trauma in her life. And as we began to do EMDR and trauma work on those memories, those thoughts, those emotions, guess what came back? Her feet. And people, when I tell this story, like, yeah, right. But it's like, we don't understand how much our thoughts really play into our physiology. And if we're in what all trauma therapy work is, all EMDR work is unlocking that story to be told, to be processed, and then to be reintegrated into the body.
Yeah.
We're not doing diagnosis. We're not doing any heebie-jeebie, voodoo type work. We're just helping them get that story out of their body so that their body can function again.
Well, and I've liked to think about how we interact with different people. If you're doing something around me or to me that I'm perceiving as just, it's super irritating, I'm stressing me out or whatever. And then a few days later, I find out that X has been happening in your life. And it kind of explains why this behavior has been happening. All of a sudden, not because you're stopping that behavior, but because I know more information and have a different perspective on that behavior, I'm less frustrated by that behavior. And so you can still do that thing to me that's stressing me out or making me frustrated. But now that I know a little bit of why it's not as bad and how nothing's actually changed,
right,
I'm just seeing it differently.
Well, and that's where I really challenge clients to go, even if you don't have an understanding of why, can you believe the best about their humanity?
Yeah.
Right. And that's, again, becoming present and okay with yourself. And so I guess my question for our listeners is, when was the last time that you really just sat with yourself? No distractions, no TV, no phone, which really creates some interesting escapes for our neurotransmitters and our pathways and that kind of stuff. One of my favorite things to do, so in our neighborhood, we have our mailboxes are about a half mile away from our house. So we drive up there, we walk up there, but there's like 3 or 4 benches that overlook this 86-acre lake.
Yeah.
And it's today, it's in here in Colorado Springs, it's actually been like nice for a change. Right. We've got 60, 65 degree weather. And so I was up there yesterday and I just sat and let the wind hit my face and just the smells and the sounds. And I missed that because it's been so cold and we've been inside and that kind of stuff. But that's what I'm talking about. When was the last time you just allowed yourself to sit someplace free of distraction and to go, okay, and this is where I challenge my clients. So I'll challenge you, like, sit with yourself and then start, what are you noticing? don't judge, don't try to fix, but what are you noticing? Well, I'm having a hard time getting comfortable. Okay, why? Take a couple deep breaths. Well, I can't take a deep breath because I get stuck in halfway between that. Okay, well, and so you start paying attention to those things again, without judgment, without trying to make sense of it. And if you can do that, at least 10 to 15 minutes every couple of days, you begin to your awareness of yourself is going to deepen, even in the midst of go or busyness.
Yeah.
And I think it's a discipline.
Totally.
It's an art. It's a discipline. It's a intentional fix. I don't know.
One action that I've started to do that has really helped with practicing presence is what most of the time I can recognize when I have the urge to pull out my phone. There are a significant amount of times when it's automatic.
Sure.
I'm not feeling it. It's like, oh, I'm looking at my phone. When did I pull it out? I don't even remember that.
Yep.
But if I can catch myself in, I want to pull out my phone because my date just left the table from dinner and I'm here by myself until they come back. I try to just leave it in there in my pocket and just look around and just what's going on around me. What are the things that I haven't noticed in my environment? What are the things that I haven't noticed about the food that I'm eating or the taste in my, like things like that. And I think we so often run to our phones to evade presence.
And I want to remind most of our listeners, you remember the iPhone came out 12 years ago. 2007. So
yeah, it's not been very long.
Not been very long, and it seems like we've had it forever. But
yeah.
How I think with that, I think that's a good lead in or finishing to encouraging our listeners to just take stock of their environments.
Yeah,
and what distractions they do have. How often do they avoid because they run to their phone or the TV or they need music or they need something.
You can go back and listen to our silence episode of the podcast. It was a pretty good one.
It was a good one. But I think we could talk much more about this, and I think I want them to stay tuned for next week's episode because I'm going to do some plugs for some people that we really appreciate that can talk them and walk them through this in a reading a book or listening to it on audio.
Yeah. Thank you for joining us. We hope this has been helpful to you. If you want more information, you can contact us at candid@mayfieldcounseling.com. We'll see you next week.
Thank you for joining Candid Conversations. If you would like more information, you can email candid@mayfieldcounseling.com or call 719-452-4803.